Okay, let's just dive right into this explainer because honestly, dealing with senior care in California can feel, well, absolutely overwhelming. It's like navigating this massive maze of confusing acronyms and surprise medical bills. But hey, take a breath. We're going to break this down together, step by step, and map out exactly how Medicare and Medi-Cal actually work. You have never had to think about this before, and now you do. Man, that quote just hits the nail on the head, doesn't it? It perfectly captures that infamous 11 p.m. kitchen table crisis. You know the exact one I'm talking about. You're completely exhausted, staring at a stack of hospital discharge papers, and it suddenly hits you. You don't actually know the rules of the game. Just imagine standing in a busy hospital hallway. A discharge planner hands you a thick folder, casually mentions skilled nursing, and asks which insurance your mom has. You broadly say, Medicare. She nods and then drops the bomb. Okay, and does she also have Medi-Cal? And you just freeze. Because wait, you didn't even know there was an also. So, to get you unstuck, we've got a super clear roadmap for today. We're going from that initial kitchen table crisis to untangling Medicare versus Medi-Cal, navigating what we call the Medicare cliff, figuring out how to braid your coverage together, and finally, we'll wrap up with a concrete, immediate action plan. All right, starting right at the beginning with that kitchen table crisis. That initial shock of realizing you're suddenly in charge of navigating a massive healthcare puzzle. Which brings us straight to part two, Medicare versus Medi-Cal. To make any sense of the massive pile of paperwork and that super confusing hospital hallway conversation, we first have to pry these two entirely different systems apart. I mean, they sound almost identical, right? And people in California use the names interchangeably literally all the time. But let me be clear, they are absolutely not the same thing. Medicare is the federal card you get simply for getting older. If you hit 65 and you've paid into Social Security, boom, it's yours. Medi-Cal, on the flip side, is California's very own specific version of Medicaid. It's a state-run safety net, and it's based entirely on financial need. It basically exists for one major reason, because Medicare does not pay for everything an older person is going to need. No, when a senior actually manages to qualify for both of these programs at the same time, they're called a dual eligible. In California, you're going to hear the slang Medi-Medi tossed around a lot. It simply means your parent has two different cards in their wallet, and both of these giant programs will eventually step in to pay for different parts of their care. It's kind of like having a backup parachute. But that brings us to a really crucial concept. Let's talk about the Medicare cliff. Here is the single most dangerous assumption families make. They think Medicare is this complete, all-encompassing golden ticket that covers absolutely everything forever. Well, it doesn't. Medicare Part A has some extremely strict limits. It will pay for a maximum of 100 days in a skilled nursing facility. And there's a huge catch. It only pays if the stay follows a qualifying hospital visit. And, this is the kicker, only if the patient is actively improving. Okay, we really need to pause here for a second because this is the bombshell that catches literally almost everyone completely off guard. After that 100th day, Medicare pays absolutely nothing for the facility. $0, nada. And honestly, for a whole lot of families, Medicare stops paying way, way before day 100. The very second the patient plateaus and stops showing measurable improvement, that's the cliff. The money just stops. The reason for this terrifying cliff really just comes down to definitions. See, Medicare only pays for what's called skilled care. We're talking highly specialized medical interventions. It's the kind of care that absolutely requires a trained registered nurse or physical therapist, someone who is actively treating a complex medical condition, like managing IV antibiotics or doing intense post-stroke physical therapy. Conversely, Medicare does not pay for what the system calls custodial care. Custodial care is that long-term, everyday human help that, let's face it, most seniors are eventually going to need. It's getting out of bed, it's taking a bath, getting dressed, eating lunch. It doesn't require a fancy medical degree to provide, but it absolutely 100% requires another human being in the room. So the really crucial takeaway here is that all of these long-term necessities are left completely unfunded by Medicare. Assisted living rent? Yeah, not covered. Long-term nursing home stays after you stop improving? Not covered. A caregiver coming to the house to make dad lunch and help him bathe? Definitely not covered. This is exactly the moment families start to panic. And thankfully, it's exactly the moment they discover that Medi-Cal exists. But here's the thing. I found some massive relief in the research. And guys, it is a total game changer. As of January 1st, 2024, California practically eliminated the terrifying asset limit for most seniors applying for Medi-Cal. I mean, for decades, seniors literally had to spend down their entire life savings to almost nothing just to qualify. It was awful. Now, for most of these categories, that scary asset cliff is completely gone. Sure, income rules still apply, but this massive policy shift opens the door for thousands and thousands of families who previously thought there was absolutely no way they'd ever qualify.
Okay, so how does this actually look in practice? Let's move to Section 4, braiding your coverage. Let's look at a real-life scenario of how these two programs literally braid together. Basically, Medicare handles one side of the equation and Medi-Cal handles the other. Imagine a 78-year-old mom who takes a bad fall. On day 1, Medicare pays for the doctor. Days 2 through 4, Medicare covers the hospital stay. Then she goes to rehab, and Medicare covers that early, intense, skilled care. But let's say around day 45, she plateaus, she's just not improving anymore. Boom, she hits the cliff. Medicare exits the chat. But because she's a dual eligible, Medi-Cal steps right in like a safety net to catch her, becoming the primary payer for her ongoing care. Once Medicare exits, Medi-Cal covers this long, slow tail of help. It can pay for the nursing facility. It can pay for in-home supportive services so someone can actually be paid to care for her at home. It even covers community-based adult services and, depending on your county, something called the assisted living waiver. Plus, Medi-Cal often swoops in and absorbs the Medicare deductibles and premiums that usually wipe out middle-income retirees. It's just huge. Now, I know what you're thinking. Managing two different giant government bureaucracies sounds like an absolute nightmare, right? Well, under California's CALM initiative, dual eligibles have a really cool option called a D-SNP. That stands for Dual Eligible Special Needs Plan. It's essentially a type of Medicare Advantage plan that brings both Medicare and Medi-Cal together. So instead of making endless phone calls where one agency says, "Oh no, that's the other plan's problem," you get a single coordinated care team. Much better. All right, let's bring it all home with Part 5, your immediate action plan. We've covered a lot of theory today, the definitions, the timelines, the whole shebang. But theory doesn't help you at midnight when you're stressed and overwhelmed. So let's get super tactical. I want you to take these first 3 steps immediately. First, literally go snap a photo of the front and back of your parents' Medicare card right now so you always have it on your phone for those 2 a.m. hospital questions. Second, ask your parent and check with the county if they actually already have Medi-Cal. You'd be surprised how many seniors completely forget they enrolled years ago. And third, request a Medi-Cal application from the county right away. Yes, even if you assume they won't qualify because of the old asset rules. Remember, the game totally changed in 2024. Next up, find and save the number for your local HICAP office. That's HICAP. These are free, totally neutral counselors funded by the state, and their entire job is to help you navigate this exact maze. If your parent is currently in a facility, I want you to gently but firmly force the discharge planner to answer 3 specific questions in writing. What is the exact discharge date? What level of care is recommended? And crucially, who pays after Medicare stops? Get it in writing. And finally, please just ignore anyone knocking on your door or calling you up trying to sell you a Medicare Advantage plan cold. Just ignore them. Okay, take a deep breath. Seriously, you are exactly where every other family is when this wild process starts. It feels like a lot, but the system actually rewards families who keep asking questions, who actually call HICAP, and who demand answers in writing. I promise you tomorrow you will know more than you did today, and honestly, that is the only direction this goes, upward and forward. But there's still one huge question staring us in the face. What if a facility just isn't the right fit? In California, there's this somewhat hidden system called in-home supportive services, or IHSS, that actually pays family caregivers to provide care right at home. But it really forces us to ask a tough question. How much is a family member's time truly worth? And how exactly do you unlock those funds without losing your mind? Well, we are going to completely demystify that entire process in our next explainer. So what are you waiting for? Until then, make those phone calls, grab those applications, and remember, you've absolutely got this.